sir.
That's 641-4878. We are your local law firm.
Go Vols.
Okay, I don't know if you were like me, but for a long time, my local pharmacist was really kind of my go-to. If the kids were sick, if I had a question about a prescription, just a general health question in my life. But so often now it's getting harder and harder to get access to that local pharmacist as things are changing. So Ed Jones, Katie Kuhlman are here from Nutrition World, and no surprise to me, they're on it. They have a new addition to the team there at Nutrition World in the back, Dr. Kurt Deering, who will talk to. You are a clinical pharmacist. You're excited about this, Ed?
I'm beyond excited. All the stars aligned for us to get together. He's had decades of experience in helping to manage pharmaceuticals for his patients. And what I've always been alarmed about is the over-exaggeration of the fears of mixing pharmaceuticals with vitamins and minerals and herbs. There is something that we have to be concerned about on some level, but it's been so exaggerated because often in the history of all information, the first thing that is published becomes carved in stone.
Sure.
It is so much less dangerous than we think it is. It is still something we need to think about and know, but realize that your traditional health professional got 3 hours of nutrition training in their 8 years of school. They don't really know. It's not their fault. They don't know any of this, and there tends to be always a bias against nutritional therapies in health management. It's changing, but slowly changing. What I want to do is put together a plan of very safe, proper information to empower people, because if you don't embrace nutraceuticals, which are vitamins, minerals, as we age, it will determine you will not be as healthy. There's no way you'll be as strong. You will not be as resilient. Not doing it is the biggest risk to me, but you got to do it with wisdom. But we have people with 81 milligrams of aspirin. I don't think I can take anything. That's because the medical model should embrace more of this common sense.
Okay, Dr. Deering, you're in the hot seat. You're sitting on the back row, but you're in the hot seat now this morning. So there might be a lot of people who have been taking some supplements, but they're kind of self-doing it. With you being there at Nutrition World, they can come to you, right? And you'll kind of personalize it for them. Is that the idea?
Yep, that's the idea. And also, just to speak what he was talking about, there was a study that was done in the American Journal of Medicine, and they surveyed about 2,000 patients, and of those patients, about 40% were taking dietary supplements and prescription medications. They found a little over 600 potential interactions there, and only 107 of them were considered to be clinically significant. So they followed out the study to the end, and the conclusion was that the risk to the patient is very low, or the risk was low, and that there was no serious adverse events in these patients at all. So whereas there was a lot of things that would pop up that would say, well, be careful here, and 103 of them or 107 of them saying, this could be clinically significant, could be a problem, probably shouldn't use them. Well, they just actually evaluated it and said, no, there's nothing really here. And that kind of mirrors what I've seen in my career. My 30 years, I ran a Coumadin clinic for 25 years, and as anticoagulants, blood thinners are well known to have a lot of interactions with things. And the truth is, and even with that one, it's considered to be higher risk because it's what they call a narrow therapeutic window. You can really go toxic quickly and things like that.
Right.
Even those never really ended up panning out to be much of a problem. So it's a little bit overblown. That doesn't say that there can't be.
Right.
And there are certain situations like organ transplant patients and things that you really need to be careful. You need to know.
Sure.
But I think the biggest risk, of course, is, and I think the most common interactions are drug-to-drug interactions. Okay, that's the ones that we should be taking more seriously. And unfortunately, a lot of them get sort of ignored. And people should ask their pharmacist, I'm on these multiple medications here, which ones interact together? Because a lot of them, like I say, get ignored.
So, I mean, obviously, you're not going to get a quick answer, Katie, when you come and talk to Dr. Deering, because I mean this is your passion.
Sure.
And if we're not all using our passions for good, then what are they there for?
Right.
So like so many within the wellness center that y'all have there, you make an appointment to see
Exactly.
him?
So we have 4 coaches, and one of those is obviously Dr. Deering here, so our clinical pharmacist. And so you make an appointment, you go to nutritionw.com, you click on consultations at the very top of our website, and you'll see him listed along with our other 4 coaches. Each one has a specialty. And if you are someone that we've been talking about that's dealing with medications and wondering maybe how to come off of a few of them, maybe how to lower some, use some herbs and nutraceuticals in conjunction with, then Dr. Kurt would be the go-to for that. And he offers a 30-minute consultation and a 50-minute consultation.
Okay, so let's talk for just a second about what one of those appointments would look like. We have about a minute and a half to talk. If you are a 62-year-old man out there and you have 3 or 4 medicines, and it seems like maybe you begin taking this one medicine and then other things come your way, and now you're taking yet another one, and you're watching that medicine cabinet grow. Come to you with the 3 or 4 prescriptions and talk?
Yeah, I had a consult last week with somebody similar to what you're talking about. He was on 9 medications, and my recommendations, of course, this is all in conjunction with their healthcare provider.
Sure.
We're going to work together with them. They're going to bring back the information, but out of the 9 medications he was on, there were 5 of them that I would recommend that he can go off of. Some of those because I don't think they're the best medications in the world. Some of them, frankly, we just have better choices in the nutraceutical world. We have better options that are safer.
So let me show people how to get in touch with you, because y'all hear the website all the time, nutritionw.com. This is just one more of the team, because your healthcare journey is going to be a journey. So you may come in for one thing, heal from that, then look to do something else. They'll have a team for you there to support you on that way. And then to remember that what they're saying is your doctor is also part of that team.
Exactly.
You're not working in isolation.
Yes, we want to change the face of healthcare in this city, and that's what we're after these days.
If there was one thing I could change my 30 years prior to this, was I would open up the mind of my fellow providers to know that there's a whole nother world out there, because frankly, I didn't know what I didn't know. I've learned so much since I've been over there, and there's so many more options.
Thank you.
Thank you.
Are you wondering what kind of winter we'll have in the Tennessee Valley? Well, I'm Local 3 Storm Alert Chief Meteorologist David Carnes, and I've got the answers. Watch my winter weather forecast right now on local3news.com or on the Local 3 News app.
Hazards lurk in the places we frequent. A simple step can lead to unexpected consequences.